All right, what's going on, guys? Doing a little Zoom format today with Coach Waleed here, and then joining us today is Michele Ionno. Did I pronounce that right?
Yes, sir.
Okay. Some of you might remember Michele, spent a little time down at our place, but Michele is a licensed physical therapist, or I think I'll let him kind of speak for himself, but he refers to himself as a physio. You can kind of go into that background. But we'll let you go ahead and kind of introduce yourself, what you're up to now, and, how you would describe your title.
Yeah, well, I appreciate that. Both of you guys, Mike and Waleed, long time no see. It's been a while with the frickin' pandemic that hopefully is over soon. And I am a physical therapist. As Mike said, I own and operate Advancing Athletics, and we're a physical therapy and also performance training company. We pair well with the work that Mike and Waleed do. My associate is in Rhode Island still. That's where I was before coming back and starting a relationship with Mike. Obviously, just with everything over the past year, we haven't been as active. But Mike referred to me as a physio, and we just like to differentiate ourselves from what most people think of as physical therapy, which is passive, a lot of modalities, a lot of isolated movements. And we stand behind more so the international model. And so that's why we choose to use the term physio versus PT. It's really semantics, but essentially we integrate the work that we do on the table or in isolation, and then make sure that we're building back up so that you're ready as a client for the work that you would do with Waleed or with Mike. Like, for example, how often, Waleed, do you get somebody who's like has some PT or whatnot, and like they are back to the level they were before?
Absolutely. Just a tweak here, a tweak there. It could be really minor, and all of a sudden it's a big difference. I had a client of mine, Jeremy, actually had some last week done, and he was on his back sick, so he needed a little bit of realignment and whatnot. So he did that, and he's feeling a lot better, and it was much needed.
Yeah, and so we want to make sure that, unfortunately, there's still enough out there to where, and it also depends on a lot of different factors, of course. And, so I don't want to paint with too broad of a brush, but it's really important that we do that we get people back to like that level that they were at. And oftentimes there's a lot of gets left in the middle ground where you guys as coaches are having to do a lot of the correctives that don't get progressed because of the job that we do or lack thereof. So we really emphasize that. And that's what we do with Advancing Athletics. Not only is it in the title, but then also we want to make sure that we're an integrated component of what you do as an athlete in the gym, working with Mike or working with Waleed. So I do that. I see people in person. Our expectation is we start to ramp things up a little bit more at Canton Barbell, especially with the expansion that's going on. And currently I work out of another gym in New Philly and a little bit south of Canton. And also we have places in Worcester and in Akron that we're going to be looking out to, again, just to give, because we work with a lot of college clients and we want to be able to give them options. So yeah, and so we just have an overall platform, a well-rounded platform, or try to make it well-rounded and include things like a podcast, Fuel, Move, Recover, and some other kind of components to that, because as Mike and Waleed know, there's never enough time in the gym or in the clinic, to be able to talk. I mean, that's why we're here doing this, right?
Right. If I could hop in real quick, I'd say that's probably our biggest limiting factor in private sector is time in the gym. So a lot of times we, our methods have to kind of fit that model. Whereas, if say you're a college strength coach and you've got an off season with, up to an hour and a half, 5 times a week with your team. Whereas in our model, we might get 2 to 4 hours a week with a client. So, for us with our athletes, we don't really have time to sit there with a PVC pipe for a month and kind of groove some of the, specific movements. So we've got to find ways, especially since the parents, are paying for, essentially the way we view it is paying for a product as opposed to, paying for a 60-minute workout. Essentially, we think they're paying for a product, which is the result. So we want to find the best ways, to integrate that bang for the buck for the best results in the quickest time possible. So like you mentioned, the time with athletes is probably, the biggest limiting factor we can run into at our place.
But the other thing too, guys, is that you're not going to stimulate change unless there's a stimulus.
Sure.
Right.
Love that.
Actually. Again, this is the whole kind of point that we're getting at or that I was getting at before, is that you can't spend all of your time just doing PVC pipe hinges.
Right.
You're not going to accomplish anything. And that's whether somebody starts with me or starts with one of you guys.
Right. Tell me if you agree with this, Michele. I almost feel sometimes that, obviously when you work in our field, no matter whether it's yours or ours, the idea that technique comes before, weight and is of course, kind of a given, but sometimes I can almost feel that there can be like an overcorrection of that kind of philosophy, to where, like we talked about the FMS system and similar, not to call out one or, one specific, but you almost get into these like, functional movements where that becomes like the whole program. And I kind of love how you described it, saying there's not going to be, a change in, or how, without a stimulus, you're not going to be able to elicit the change. So I almost feel like there's almost an overcorrection where people are almost afraid of the stimulus, whether it be load or intense sprinting, jumping, or anything like that. Whether it's fear of injury, or just because that's been kind of engraved into the mind of like, it's all about technique and nothing but movement quality. But we'll have athletes that do a lift. They might look two different ways when they do it, but the more we work with them, we can figure out how they should look. We know when they're safe, when they're performing, in an optimal position, but it might look two different ways. So it's not like textbook picture of what's right and everything else is wrong. Mm-hmm. So you can kind of tell me if you agree with that kind of assessment or not.
Certainly. I think, again, I think it's fair to mention the FMS by name because it's the most commonly used, and the problem is that and we can maybe have another episode about this in the future, talking more, getting more into this. But the thing is that trying to isolate human movement into, these small boxes is one issue, as well as then also trying to assume that the way somebody expresses themselves in this limited number of movements in the setting of a test is the total examples of how they move in totality. Like Waleed, like how many guys in your experience of football, and for everybody, I played football in college too, so it's the sport I always refer back to when thinking about examples and analogies. And like how many times you see a kid who doesn't move that well, but then you get him on the field and he's actually able to express himself pretty well.
Absolutely. It might be certain coaching points, or just it's not clicking at that moment, but you tell them to go steal third base or run a certain route. They've had multiple reps at doing that. So the repetition, sometimes the awkwardness of certain movements doesn't equate to the big picture. You know what I mean?
Yeah. Yeah. And the other thing too, guys, is that if we get into the two different pieces, first is from the scientific literature, part versus whole practice, right? So you can only break down certain movements a certain way. Like, for example, it's impossible to practice the follow through, either arm deceleration when you're throwing a ball, or the follow through with your leg when you're kicking a ball, because that is a byproduct of the movement itself. So some people might see errors with the deceleration of the arm with a baseball pitcher. And so, but you can't work that in isolation and expect that the whole pattern is going to improve, because it's it's a result of the pattern, not an upstream foundation of the pattern. So I think that there's that. The other thing too is that the difference between spelling versus grammar. So some kids show up in our gym and their grammar is terrible. You know, their ability to coordinate movement is awful, but they have pretty good strength, you know? And so they are not going to get better at translating strength into movement unless you practice the movements,
Right.
you know, or vice versa. You know, you might have some kids kind of like Waleed was just saying, who are they kind of know what they're doing, but they're so inadequately powerful that as soon as variables change, everything is completely thrown off. You know, so I think that we're in this like Instagram famous kind of like era where our athletes, our clients, they see all this stuff on Instagram and they just assume that doing all these repetitions on one exercise is going to be the golden ticket to their success.
No, I agree with you. Definitely, you know, a whole other, you know, aspect of like, you know, if an athlete's seeing, you know, a lot of these pro athletes, you know, even for a pro athlete, you know, we know that a high school kid and a pro athlete don't necessarily have to train the same, but even some of these pro athletes do questionable, you know, training protocols, you know, without, you know, letting them kind of explain why, but upon viewing it, it can be questionable alone. So just because the pro athlete is doing it, you know, doesn't make it effective, because a lot of those guys, I guess they would be the guys that have really good grammar, using your analogy, coming into the gym. Those are a lot of really gifted athletes, skilled athletes, relatively naturally. So, you know, they come in and they can pretty much do a pattern you throw at them. You know, as opposed to, you know, if it's just a client in our gym or any weight room, you know, their baseline might not be there. And so kind of like you mentioned, we have to, you know, figure out what works for them, what stimulating coaching cues or whatever it might be, can dial them into where we need to be them to get the change, you know, whether it be, you know, more absolute strength or power, whatever it might be. So I kind of like how you put that and tied it into that kind of analogy, because I agree with you. There's, you know, so many different ways to skin a cat in training. And the hardest part sometimes as a coach is to figure out on an individual level, especially when you've got a lot of athletes coming through, what works for each kid.
Yeah. And again, it goes back to the fact that these pro guys or gals, like they're so committed to their craft. Some of them move really poorly. I've worked with some pro athletes before. So a lot of them, almost all of them, it's their guts and determination that allows them to be the like 1% of the 1%. So of course they have, you know, they're like anaerobic responders. So you throw everything you have at them. I had this one patient, he was a former tight end when I was still working in Boston, and I couldn't get the guy sore. I couldn't get him sore. Like I was running out of ideas. He was so responsive to whatever I threw at him. I mean, he worked really hard too, but then he'd come back a couple of days later and he almost wouldn't have any delayed onset muscle soreness because he's an anaerobic responder. And that's, apart from being, you know, 6'5", that's what allowed him to put on so much muscle mass, you know? Whereas like, you know, I helped my dad and my brother like help frame a house, you know, and just because I haven't done that stimulus in however long, like I'm sore for three days and all I'm doing is picking up plywood and 2x6s, you know?
Definitely the different type of stimulus. Most of our guys can go through like, you know, Wally, I don't know about you, but we'll get guys in, you know, a day later, 2 days later. Our kids don't really complain about soreness or, you know, fatigue or, you know, signs of overtraining at all. You know, we don't get that a whole lot, but if we throw, you know, a little bit of a type of curveball, to say like, you know, maybe for example, Wally, we'll go out and we'll do like tempoed, I guess you would call it like lactic sprints on the prowler outside. That can wipe them out if it's not some, you know, not that our goal is to wipe them out, but introducing something like that, you know, those guys will get 4 or 5, you know, sprints in and be wiped. But these guys will be, you know, hammering out, you know, 1 to 3 rep after 1 to 3 rep set, on the bar, heavy pull-ups, anything like that, all day. And they'll come in the next day and do it if we wanted them to. So yeah, we definitely see that in our gym. Waleed, I don't know if you want to add to that with kind of some of the different ages you've worked with.
Yeah, really. I mean, just an adult client. The last time I remember one of them or a kid being sore, it was a walking lunge variation that was a long time. It was longer time under tension than we typically do, and we went a little bit heavier. And he was really sore the next day. But besides that, might be a different ab variation where you're hitting a core muscle that's usually not hit, but or adding a stimulus to that. But besides that, again, it's a lot of the power and 1 to 3 rep range deal, and so we're not seeing a lot of that.
Well, and the other thing too, guys, is that the kids have to be able to challenge themselves enough and be stable enough in a movement pattern to be able to reach a level to where they're reaching their true, like near their true 1 RM. There's a difference between what we measure to be their 1 RM and what their true max 1 RM is. So, and that's not really the point at that level anyway. So obviously, when you into like guys and some of our college guys, we're starting to approach a physiological limit, and plus a lot of the majority of our, healthy adult clients, you know what I mean? They want to stay fit and they have certain goals that they want to achieve, like Spartan races or whatnot. But other than that, they don't have to find and or spend time near their true 1 RM, so if we test their 1 RM to actually be 92%, and then we're doing 90% of their 1 RM, which is actually 90%. What's that? That's 81% actually, so, but the point is remaining the same. You learn how to create tension and hold positions and shapes while you produce force through certain joints or through certain ranges of motion.
Sure.
So regardless, you might have to add a little bit more because you can't get these kids to safely approach their physiological limits, but in general, I mean, it still ends up being the same thing. The other thing too, Mike knows about this. Him and I have talked about this before, but it's what I call the Crossfitification of exercise. There's a lot of benefits to CrossFit, especially I think in the fact that it's kind of become cool to have muscles, or at least for females, I should say.
Definitely.
So like, that's really cool. It's totally like come into like the general public.
Yeah. I think it's actually for females now than males.
I know, right? Whereas like back in the day, at least like when I was in high school, there was a very, I mean, to be completely honest, not what I thought, but a lot of people, if you saw a muscular girl, you automatically assumed that she was gay. And that's entirely wrong and irrational.
Right.
So it's so great in like 20 years since I was in high school that now that's completely changed. Now it's no big deal. I worked with some high school girls and it was like, they said to me, this is a girl saying to me, it's almost like they don't think that girls lift weights. It's like, of course we lift weights. Yeah. So it's cool that just in a couple generations, it's entirely changed.
Yeah. Do you find real quick while we're on that, because you work with, you actually probably have more female athletes than we have. We're still kind of trying to pull them in. Do you find, like, just speaking on like really broad terms, do you find your female athletes, would you call them tougher than your male athletes?
For sure.
In the weight room? Yeah, definitely.
Yeah, for sure. Absolutely. The thing is that, with male athletes, you get immediate buy-in. They walk in the door and they will go through walls for you.
Sure.
The hard part is that the way that we're built as men is that we are goal oriented. So what happens is that we want to accomplish goals. And so if it's to do one, again, like 3 reps at 90% of 1 rep max, then we're going to be really excited if we can get that check that off, accomplish that. But maybe we actually could have done 93%, or whatever. That's not usually how we think, default to. Whereas female athletes are pleasers. They want to work hard. They want to push themselves because that's like their default, their default psychology. That's kind of like how they work. So what will end up happening is that they will push themselves further because of what they are trying to accomplish. Again, speaking generally, versus the boys, they'll work their asses off, but they are always so goal oriented that sometimes they don't see the forest from the trees.
Yeah, the process is something that can be tough to kind of communicate and kind of integrate in an athlete. We definitely, we're definitely not overly conservative in how we train. I mean, our guys, we essentially implement the max effort method or the near max effort method. But normally, if we're running through variations, unless you're absolutely crushing it like out of the roof, it's like a 5 to 10 PR from your previous time, and then let's move on. Even we describe it as the max effort method, but once you're kind of bought in, unless it looks like you've got, literally like 40, 50 more pounds in there, we'll take that, that new stimulus and move on. And then we'll build off where you still might, have weaknesses or holes in your performance. But that's part of it is building the process of it. Not every time. I always tell people, this can be actually like adult clients too. If it's a barbell PR or like a timed PR on something, they'll want to, look at kind of where they were last time and then beat it. And not every time they do. And sometimes they'll get upset. And I basically put it like this, I've been lifting for probably 16 years now. If I PR'd every time I worked out, I'd be like Superman, but you know what I mean? Like there's always that plateau. And then where you have to scale back and figure out on top of all the, external factors like, sleep, nutrition, stress that can have you a little off that day. The biggest thing is obviously doing it that day. Whether or not it's your best day or not, but actually doing it, putting in the work, and then reanalyzing where you need to build. Maybe it's less work. I'm sure you know about all this, but big point being, like you mentioned, the putting in that process. Sounds like maybe the females kind of get it more, I guess, than the males do in one kind of, micro period of time, like a training session. Sounds like maybe in your experience, the females might get it a little more in the process.
Oh, well, there's, again, it's back to that orientation. Sometimes the male athletes are so obsessed with hitting that PR that if they don't, all of a sudden they might have a hit the rest of the workout, a negative, there might be a negative impact because they didn't meet that goal, versus understanding that process of we want max effort, even if you don't get max rep or max weight, And so if you allow that, it's really hard. This is probably one of the biggest things I've noticed, I've discovered, Waleed, both in myself and also in clients as I've gotten, older, is that, and been doing this more often, there's an opportunity. And what it is there is an opportunity cost. There is only so much time you can spend in the gym. There is only so much effort that you have to give in a single day. And so if you aren't ready to be able to do that and give that, or if something derails you, like you're pissed off because you didn't meet your PR, you didn't get a PR today, then you can ruin that day. Not in like you're going to ruin your life that day, but we have very ambitious folks that we work with that have very lofty goals. And so they have to appreciate the consequences of those actions.
Yeah, I think, whether you're in a personal training setting or even in a team setting, understanding that with progressive overload and a max effort mindset or a new PR, or you're going up 5 pounds in, dumbbell incline as an auxiliary, whatever it is, you're either trying to beat yourself, trying to at least channel that competitiveness, whether it's against yourself or against a teammate, where, all right, it doesn't start the way you want, or you had a bad day. Well, you know what? The trainer said, the trainer is giving you that plan. All right, this is what you need to do. Either you're going to do it today or you're not. And will that competitive spirit take over? And I think that's part of our job as well.
Yeah. And I think that the to take that a step further, that's what makes it, that's the thing that we don't see with these guys doing very weird modalities as a part of their, like, pro guys. That's what we don't see, or we don't feel. You don't feel that coming through your computer screen or your phone, just how hard these guys work. The reason why some of these cockamamie modalities work for them is because they try so hard. You could give these guys a progressive overload workout of weighted hula hoops, and they will get better. Not because there's anything magical about weighted hula hoops, but it's because it's a new stimulus, and these guys and gals try their asses off at everything that they do. They never let a day go by, ever, without max effort, whether or not you're doing max reps. So they always just give it their all each time. And that's the thing, that it's uncomfortable. It doesn't feel good to push yourself to the limit every day, to show up when you're mad about, your girlfriend or your schoolwork or your parents, or you didn't get the lunch that you wanted, or, your friends were picking on you. Put all that aside, and you have to be able to. You have to have that mental compartment. What's the word? Compartment. Yeah, thanks. Thanks. But yeah, you have to be able to have that yourself hard enough.
Still there, Michele? I think I lost you for a second.
Yeah, I'm here. Did you?
You're good.
Yeah.
A couple things building off that. So, like, related to kind of the effort and the psychology of it. There's a couple. Wally, you could tell me if you've seen this before, but like, especially when we're doing dynamic, we did that video on the dynamic effort method. We can tell the science of it, to the guys, that we're trying to build acceleration here. That's why your bars, like, we need you to move that bar as fast as you can. But it takes repetition to understand kind of that feedback in your body on what maximum effort feels like for speed. I guess you say dynamic effort, but what putting the most effort into that rep is. So I don't know how many times I've seen this, but like, we'll do 20 total reps, 10 sets of 2 maybe, with dynamic effort, whatever lift it is. And I don't know how many times I've seen it where I'll tell it, we'll be 9 sets deep, and we'll be on the 10th set, and I'll say, okay, last one, make it count, or whatever, whatever I say. And the last 2 reps are just visibly miles faster and crisper than the previous sets. And it was like something psychologically made you put your real full effort into those reps. And I'll tell them where was that the last 9 reps? And it's a process, that word again, but learning the psychology and how it connects to performing an action, whether it be, in one of our settings or in the field of play. But Wally, I'm sure you've seen that before in dynamic effort. But and on top of that, just a quick note, it's why Michele, you can tell me if you've ever done this, but I'm not real big on that RPE scale. I might ask somebody, what do you think about that one? But a newer lifter, or again, not to generalize, but some female lifters might pull a rep based on the speed that was definitely like 6 out of 10, just looking at it on speed. But in their mind, they're perceiving it as like a 10. You know what I mean? They think, weight in their hands. We know that like a 10 is like, that bar is going to take 5 seconds probably to get to the, the full range. But to a novice lifter, or just various different, lifter personality types, just a little bit of strain to them might, they might automatically say 10. That was brutal. So I'm not real big on that RPE scale, for doing, for actually programming intensities, I guess. Like I said, I might get a little bit of feedback, set to set, where do we want to go from there? But I've kind of phased out using that for the most part for that reason of kind of the psychology of it.
Yeah. Do you use that at all, Waleed?
No, I've actually, I follow a couple of people that, Zach DeShant, who's TCU's, he's really big into that. And I think it makes more sense, I guess, in a macro. If you have guys, you're going to have guys all year round. And I feel like, you have guys 12 months a year, and you're able to, progressively overload using that system that that might make sense, but I have not used it myself. I would think that would be the only setting. I mean, if we know we have a guy for 2 months here at the gym, I don't know if I would use that, just because we need, like Mike said earlier, a little bit more bang for your buck in that 2-month window. So.
Yeah, I mean, and this is why I love these conversations, is because, I get to bounce stuff off you guys, because my primary role is not a coach. And then obviously my primary role as a physio, I'm able to offer my opinion because of the lens that I have, as being somebody who's always looking at self-actualization and working on, I run into, how many times you have a kid. This is the point that I'm getting at. How many times you guys have kids to where they like don't show up for a training session, and it's like, where were you? It's like, oh, my back was sore. It's like, what? When did that happen? He's like, oh, it's been hurting for a couple weeks or whatnot. And it's like, well, why didn't you say that? This is my job, is like to help you deal with these issues before they become issues, right? And so the benefit that I see with RPE is not intra-session, it's inter-session. So it's asking them at the end of the day, how did that feel? How hard do you think that you worked? How tired are you? So starting to understand what people pay $1,000 to Whoop and Oura Ring and Fitbit and all these other companies that are essentially creating algorithms to tell you how you feel, and there is some power to it, but you should be able to start to have an understanding about, like, this is what tired feels like, this what not bad feels like. And then the other thing too, the only thing that I'll add from not beyond everything I just said is that I think there is some power to, like, these kids being like, you think that was hard? It's like, we're going to push even harder than that. And then maybe you see one exercise where they can reliably say, okay, that was hard, like a 7 or an 8, but that wasn't a 10. Well, then it's like, okay, I need that 10 effort that you do with the prowler, and I need you to put that into your dynamic effort deadlift or whatever the case might be. So I think it can be a powerful transfer tool, but again, we are the ones that we have to put our athletes into situations to where they have the opportunity to learn what it's like to push themselves.
Sure. Yeah. Your description of it, I do like. You almost put a more qualitative, kind of factor to it, as opposed to just the strict 1 to 10, like almost like you're trying to match 8 to 80% is kind of where I'm coming from. I do like, kind of how you describe that. 'Cause there is, we're big on data, Wally knows, but I definitely don't want, again, the qualitatives to be ignored. Speaking of that, because you mentioned, like, how do you feel? And then like the whoops and all that. Have you read Unplugged?
Mm-mm.
Okay. It's so we're like this little 75 hard thing we're doing now. We have to read. So it's interesting. That's what the whole book's about. It's about basically like fitness technology and how it could be counterproductive to your kind of interpersonal, like, connection with how you feel, essentially, and your body making adjustments. So it's kind of interesting. I just started, but I didn't know if you would check that out, because that's exactly what the entire book it deals with.
Yeah, well, and that's you guys have to remember, and the more so the audience rather than you two, because you two know me, but I'm surrounded all the time with people telling me about, what I mean, how they feel and like all these other kinds of things, and so I think it can be. It's actually, I just wrote an article for this that'll be going live tomorrow on my website, all about heart rate variability and how it can be useful if it holds you accountable, or if it's something that can validate how you feel. So if you're ignoring how you feel throughout the day, during training sessions and whatnot, that's absolutely unexcusable, period. But if you do a good job of that, and then you're not sure if you're tired because you've kind of had like you've had a bunch of cancellations, like maybe the snow, or like here in Ohio, it's really snowy right now. And so it's like we might have a bunch of cancellations because of the roads. And so then it's like, you're kind of in a like low arousal state and you're kind of tired, but you also kind of worked hard yesterday. So you're not really sure which one it is. Am I just like understimulated, or is it that I'm actually more tired than normal from yesterday's workout? That's where these wearables and whatnot can be useful,
Mhm.
you know. But beyond that, you should be relying on what your body is telling you rather than just relying on the information that a watch, some proprietary piece of tech tells you.
Sure. Yeah, it's as much as our job is with coaches to like read things and body language and collect info. There's no one that can talk, tell you more about your kind of physical state than your own body, your own self, kind of listening to it. It's the same thing with going to a doctor. If you don't, tell the doctor truly how you feel, what's wrong, what's good, then the doctor can't give you a good diagnosis if you're not giving them full info. It's the same with us. So, yeah, I kind of like, where you're going from there. And then again, with the wearables, I kind of like the idea of kind of the progressives with it too, because I know that they most of those I was kind of reading on the accuracy with like calorie burning, for example. Most of them, have a certain degree of error, kind of depending on the exercise modality. But if you're using that same device and you feel good, so you can say, I still feel good, I feel about the same, but now it's telling me that I did 100 more calories, then you've kind of got a win-win. You can kind of sit there and think, well, I didn't even really try to work all that much harder. I feel fine, but you're getting that much more output. Then that's another way I would say there's some use in that.
Yeah, I think it goes back to accountability.
Yeah.
It tells you, like, if you look down, if you think you've had a busy day, and like it totally depends on me. It's really funny, Waleed, is that I can tell how sick my patients are by how many steps I get on my Garmin watch. Because if I have a bunch of new people, or like if they're post-op and we're spending a lot of time on the table, not moving around, I won't get my steps in, my 11,000 steps by the end of the day, because I spend most of the time on my stool next to them on the plinth. Versus if my patients are higher level, we're up doing dynamic exercises and I'm usually somehow either participating and or throwing them balls or coaching them or helping manipulate their shoulder or whatever. All of a sudden I'll get my steps. So it's really useful for somebody like me who has a relatively active job. I don't, my default isn't sitting behind a desk, but even though that's the case, my activity level can vary wildly, kind of like depending on what I just said. So that's how it can be a really useful accountability tool for somebody like me.
For a couple things, there's two things, and you mentioned a little bit, Michele, is that the relativity of what you feel like is a lot of work, and you might, and then there's the maturity as well. So, for example, we talked about, this is kind of tying in the last couple of things we've talked about, from a dynamic effort. When I was at Mentor, my last couple of years there, we were, strictly conjugate method. And I literally needed to teach a class on the dynamic method for them to understand why we were doing that. It just took, and you had your kids who just, when are we benching? When are we doing the 1 rep? And then you had, kids who kind of dug into deeper to what I was talking about and said, oh, I get it. I get why we're doing this. So I think there's a maturity to that, along with knowing where your body's at that day, because young, old, male, female can use that as an excuse not to do something, as opposed to a reason to progress in some way or another. So I think it's between maturity and relativity to the situation that's unique to the individual and potentially to a team setting as well.
Awesome. Good deal. Michele, anything to add to that? I'm looking here for this. We're probably going to be wrapping up in a few minutes here. So any any closing thoughts for you, kind of just where we kind of winged it tonight, worked out well, just kind of, whatever's on the mind, but any kind of closing thoughts for you?
Yeah, I mean, I would just say, whether you're a coach or client, I mean, accountability is huge, and that reflection piece is even bigger. So, because if you don't ever reflect on how you're progressing, how you're doing, how you're approaching your sessions, then you're going to have a really hard time accepting new stimuli, making sure that you're getting the most out of whatever it is that you're doing. Sometimes that's even a recovery day. We want you still to have kick-ass recovery days, even if that may not be, that you're really maxing out we still want max effort, even if it's not max weight, I guess.
Right. There's always a max effort you can put into what you're doing, I guess, even if it is something simple. It's kind of something, I preach about, like, and I'm sure, Michele, you probably are deep into this, but like if we do mobility work pre-lift, you can't just go like through the motions, for true mobility work. Cause like me and you both know, we kind of agree on a lot of this stuff, but like say I'm looking to get like hip activation and kind of like train that hip to get ready to get into some serious rotation. I've got to actually create contractions to kind of train that joint per se to get, into ranges when I get into squat. So I can't just lay on the floor and say, okay, I'm in position. Like some of the stuff we do, I'm like, no, you have to contract, like create this isometric. So you've got to be like putting in that effort. Like sometimes we'll say like drive it into the floor, crush it into the floor, whatever cue we're using. So you can't just be in the position and just, yapping about whatever with somebody, stuff like that. The breathing we do at the end, it takes, sometimes we'll try to get these guys, to train their breathing, obviously diaphragmatic is the big word, but you got to think about that. You've got to like actually think about where you're expanding from, putting in an effort to learn to draw in long inhales and long exhales. It's tough. Like I tell these guys, even like a breathing drill is work. So yeah, what you said there, and then the accountability thing. I think there's an optimal amount of coach to athlete or client, kind of back and forth. I really like to, put as much as I can on the athletes and clients as I can. I'm not really, I definitely am not into like the motivational stuff. Number one, it's not really my personality. And number two, it's just kind of a setup for, potential failure to rely on someone else, especially I feel like now more than ever, kids, we've got 13-year-olds that travel for weekends for baseball tournaments. We've got people hopping all over, doing stuff all over the place, and there'll inevitably come a time where you need to do your routine, no matter what it is, in a hotel room or in a vacation house or whatever it is. And you've got to be, accountable to realize, why do I need to do this here, even though it's just a weekend, and do it right when your coach isn't sitting right there, telling you every single little thing to do. So yeah, I like the self accountability, and the kind of, I guess I don't know what the word would be, but intrinsic or just kind of whatever you would call it, just installed in the individual.
Yeah, intrinsic motivation.
Sure. Yeah. So yeah, I like that a lot. And again, it kind of fits my coaching style anyway. So Awesome. Wally, anything?
No, we got the youth. We're 6 and 7, Monday through Thursday. So getting that rolling, and it's a good group so far.
Yeah, looks like it going real well. Kind of like we mentioned earlier, definitely looking to fill with some female athletes as well. Come show the boys how it's done. Michele, tell us, I guess, anything new, exciting that you're working on. You kind of mentioned your podcast briefly, but I know you're actually on, I believe the Apple Podcast app.
Yep.
Yeah, go ahead and talk about your.
Yeah, you can go to Spotify or Apple Podcasts. Just search Fuel, Move, Recover. It'll come up. It's with another. It's with my partner in crime, Alex, She's the one who founded the company with me. She's also a physio, as well as Lindsay Malone, who's a registered dietitian in the state of Ohio. She works out of Cleveland and with Case Western Reserve. She's on the faculty there. And so, so we talk about any number of things. Like I said, I'm writing an article this week about heart rate variability, and we'll be discussing that on a podcast. They usually drop Fridays at noon. We record every week. It's like a Patreon style, if people are familiar with that. So we're just expanding into doing more of that stuff and taking advantage of the fact that people are now more comfortable than ever with a virtual platform for programming and or for rehab, movement consultation. So we're just starting to expand that and try to utilize that space now that people are more familiar with it and comfortable with it. So so you guys can check out that stuff, that, or just hit me up on Twitter or Instagram at Michele Ionno, MicheleIonno.
Awesome. Cool, man. It was good. Real good talking to you again. Definitely got to do this again. I know our schedules are a little nutty, which is great for all of us. But we'll definitely stay in touch. Would love to, dive deeper into a little bit of movement stuff, joint by joint stuff, anything, that you kind of see. Cause we hop into stuff and then you can go, even deeper into some of that. So we'd love to do that again. So we'll talk out some details and hopefully be back here soon.
Yeah, I'd love that.
I thought I lost your audio for a second. All right.
Oh, sorry. Yeah.
Appreciate it, you guys. We'll let you guys get some food or whatever it might be and get some sleep, and we'll be at it again next time.
Yep. Take care.
Thanks, guys. See ya.